Healthcare stocks drop as lawmakers and patients demand changes to business models. Shares of leading healthcare companies, including UnitedHealth Group, Cigna, and CVS Health, fell by up to 5% on Wednesday amid growing pressure from lawmakers and patients to overhaul their business practices. These companies, which operate some of the largest private health insurers and pharmacy benefit managers, PBMs, in the U.S., also own pharmacy businesses. By early afternoon trading, their stocks had dropped by at least 4.8%. The decline comes in response to new bipartisan legislation aimed at breaking up PBMs, first reported by the Wall Street Journal. PBMs have long faced scrutiny from Congress and the Federal Trade Commission, FTC, over accusations that they inflate drug costs to maximize profits. Adding to the market jitters, healthcare companies have been under heightened public scrutiny following the recent fatal shooting of Brian Thompson, CEO of UnitedHealth Group's insurance division. Healthcare stocks had already seen declines in the aftermath of his death. New legislation targets PBMs. A Senate bill, introduced by Senators Elizabeth Warren, Democrat Massachusetts, and Josh Hawley, Republican Missouri, seeks to address concerns about conflicts of interest in the healthcare industry. The proposed legislation would require companies owning both health insurers or PBMs to divest their pharmacy businesses within 3 years, according to the Wall Street Journal. A companion bill is expected to be introduced in the House this week. PBMs have manipulated the market to enrich themselves, hiking up drug costs, cheating employers, and driving small pharmacies out of business, Warren said in a statement. This bipartisan bill will untangle these conflicts of interest by reining in these middlemen. The lawmakers argue that the dual ownership of PBMs and pharmacies creates a gross conflict of interest that allows these companies to profit at the expense of patients and independent pharmacies. Dominance of PBMs in the market. The largest PBMs, UnitedHealth Group's Optum Rx, CVS Health's Caremark, and Cigna's Express Scripts, are owned by or closely tied to health insurers. Together, they manage around 80% of all U.S. prescriptions, according to the FTC. PBMs play a central role in the drug supply chain by negotiating rebates with drug manufacturers, creating formularies, lists of covered medications, and reimbursing pharmacies for prescriptions. However, critics allege that their practices increase drug prices and disadvantage independent pharmacies. Ongoing investigations and public criticism. The FTC has been investigating PBMs since 2022, focusing on allegations of anti-competitive behavior and profit-driven practices that harm patients. This scrutiny has intensified as lawmakers and patients push for transparency and fairness in the healthcare system. The pressure on PBMs comes at a time when public criticism of insurance companies is growing, further compounded by recent high-profile events. Wednesday's legislative developments add to the uncertainty facing the healthcare sector, with potential long-term implications for business models and market dynamics. Hey everyone! I just wanted to take a moment to say thank you from the bottom of my heart for all the love and support you've shown on this channel. Whether you're a longtime subscriber or a first-time viewer, your likes, comments, and shares mean the world to me. Your engagement inspires me to keep creating content and striving to make every video better than the last. I'm incredibly grateful for this growing community, and I couldn't do it without you. If you're enjoying the journey, don't forget to like, comment, and subscribe if you haven't already. Let's keep growing together and making something truly special. Much love. Team Buzzwire.